internal medicine, and all things COVID and coronavirus. So first, Dr. Coley, can you tell us what we need to know about COVID-19 today?
So we've had a few positive trends in our state actually in the last couple of weeks. So testing has gone up. So last 2-week average of tests per day is 3,720. Now that's still below the governor's goal that he had set for May 15th, which was 5,000 a day, but certainly heading in the right direction. The number of hospitalizations continues to go down. So the 2-week average over the last 2 weeks was 566 hospitalizations compared to the last 2 weeks in April, which was 803. So that's also trending in the right direction. We also had a big change last week in the way that we're classifying our COVID deaths. We've now broken up the classification into 2 categories: people who die with COVID, and that's the big umbrella classification that includes everybody who's tested positive for COVID, and then people who die from COVID, which is a subset of that big umbrella classification of people who die directly as a result of COVID-related complications. Now, this is a little bit tricky because when somebody dies with COVID, for example, with a mental health problem. So we had a physician a few weeks ago who took her life, an emergency room physician, Dr. Breen, and she didn't have COVID, but she died as a result of the COVID pandemic or the stress imposed by the pandemic. So it does become a little tricky when we talk about classifications and the impact of this pandemic, because even though the virus itself may not have directly contributed to her death, it certainly indirectly contributed through the stresses imposed on life.
Yeah, we've addressed this before too, that, healthcare workers, those in the medical field, sometimes just, have to put on that tough face. They feel like they need to kind of hide how they're feeling to take care of others. That kind of leads into our first question. Dr. Nordstrom, I'll ask you first, what are some of the unique stressors and mental health challenges that are facing these healthcare workers during COVID-19?
Wow, yeah. Well, there are many. The top 2 that come to mind, the first one I've personally experienced being an emergency psychiatrist over at Ian Schuetz. And that is where, as anyone who's frontline, be it in the emergency department, be it the firefighter, we tend to gravitate towards unsure circumstances. The firefighter running into the burning building, that kind of thing. And we understand that our health can be sacrificed. What made this particular infection tricky is learning that we're infectious before we may have symptoms. And I think that caused a lot of pause and a lot of angst for emergency workers, for frontline workers, because it's one thing to sacrifice yourself. It's another when you might bring it home to your spouse, to your children, maybe to your aging parents. And I think that stress is always on our mind. The other, which has been talked about a lot more, is around the death, right? Teams are finding that their best efforts just aren't good enough. And death is always uncomfortable for anyone trying to help prevent it. But when it's happening again and again, and your best efforts just aren't making the grade, that has such a negative impact. It's hard to overstate it, and it very much affects the frontline worker.
Right. And Dr. Thurstone, I don't know if you want to add to that at all or chime in at all on that, just some of the unique stressors and mental health challenges facing these healthcare workers right now.
Yeah, I would just really underscore also the aspect of uncertainty for anyone in the world right now. There's so much uncertainty revolving around the pandemic, and for humans, uncertainty is one of the biggest stressors, even more stressful than difficult times when things are more of a known entity. So all this uncertainty is just really stressful for everyone. In addition to what Dr. Nordstrom also said in terms of some of the specifics, other things that healthcare workers are dealing with is managing innumerable new and cumbersome new practices and protocols for around infection control. These things are changing. People are having to keep on top of this, on top of their regular duties. It can be really overwhelming, and then all of this in a setting with limited supplies, lack of supplies, uncertainty around that, and feeling unequipped. Those are some of the other things that really impact people.
And Dr. Thurston, you can add to that. I also want to ask you too some of the signs of burnout as you answer that first question, but just talk about the signs of burnout too, and any other mental health issues they may experience.
Yeah, sure. We're starting to see some data around this too, in terms of papers coming out from Wuhan province, China, and the impact of COVID pandemic on healthcare workers. And in one study coming out from China of over 1,200 healthcare workers, it showed that about 70% reported some kind of psychological distress. About 50% reported some kind of depression. About 35% reported they were having difficulty sleeping. So we know it's having an impact on healthcare workers. Some of the themes that they talked about in that paper had to do with isolation from family, not seeing their family for a while. One of the things we haven't talked about so far is discrimination against healthcare workers. So somebody finds out you're a healthcare worker and they don't want to have anything to do with you because you might have had contact with somebody with COVID and therefore be somebody to transmit it. Other issues, exhaustion was another issue, death, and Dr. Nordstrom started talking about this as well, the whole concept of moral injury. And so just dealing with death and having the thought that, is there something more that I could be doing? I did everything I could, but maybe there was something more. And that goes along the lines of moral injury that's been described with healthcare workers in the age of COVID as well. Now, in terms of signs of burnout, we already mentioned them. It's feelings of exhaustion, feelings of numbness have been described as well. And then some irritability, difficulty sleeping are some of the signs of burnout in healthcare workers. And already about, depending on the specialty, about 40% of physicians, nurses describe themselves in a state of burnout. And so we would anticipate that would increase during the age of COVID.
Right. And, it's not the beginning anymore, but it's not really at the end either. We're probably in this for a little longer. Dr. Coley, maybe you can give us kind of some projections about that. We kind of flattened the curve. So hopefully we avoided, overwhelming our hospital systems, overwhelming those healthcare workers too much. I mean, obviously they're still overwhelmed. But maybe talk about, the duration of this. And then as a provider yourself, you're a cardiologist, likely have friends, I'm sure, that are frontline healthcare workers, just what you've heard and seen as well.
Yeah, so it's very difficult to predict exactly when this will be over. It will be over, but it's hard to know exactly when. Definitively, we know that the vaccine is certainly going to, be a vaccine that works and is safe is going to be the definitive endpoint. But when that exactly happens still remains a moving target. We've heard from Dr. Fauci that it could happen, as early as next year, January of 2021. And we've heard that we could be in this mode based on modeling out of Harvard Medical School up to 2022, summer of 2022. So it's hard to know exactly when it's going to happen, and different states and different regions will certainly have different timelines depending on the burden of disease that they have. There are places around the world like New Zealand that have effectively not just flattened the curve, but crushed it and really have no more cases and no more morbidity or mortality. And yet there are others like Brazil and here in the United States where the cases continue to climb. So as you said, we're still in this for a little while. And I do think we have to pace ourselves mentally and physically according to a timeline that could last several more months. I think as a healthcare worker, it has been a really, really dramatic shift for me for so many reasons. The first is the fact that everything I was taught in medical school and how to practice medicine has really been turned on its head. We threw out the rule book when it came to this COVID pandemic, and we were, treating before we had testing, making presumptions about diagnoses without testing. We were using therapies before they were proven, really doing a lot of things that scientifically cause some of that moral injury that Dr. Thurstone, Dr. Nordstrom, and Dr. Marquardt have referred to. And this is all in a background of the fact that many healthcare workers already came into the pandemic having a high rate of burnout. So there are estimates that a third to a half of healthcare workers have some or many signs of burnout. And on top of that, you add long hours, you add wearing PPE head to toe, you add worrying about the risk of contaminating yourself or your family, you add the fact that even physical things like taking a break for water or taking a break for the bathroom, are much more challenging than they were before. And then you layer on all this uncertainty about what the right thing to do for your patient and for yourself is. And all of those factors really culminate to provide a big sense of fear and create lasting psychological effects. And we saw from the SARS and MERS epidemic that healthcare workers who actually had these psychological effects during the pandemics actually went on to then continue to have them or have recurrences later in life. So it's not just what happens today, but something that's going to continue to happen. We talk about flattening the curve, but one of the things we have to keep in mind is that we all need to work on flattening the curve of mental health, because the mental health morbidity and fallout from this pandemic is likely going to last a lot longer than the actual virus itself. And that timeline that I talked about will be several years, if not decades, from the mental health effects. So I think awareness, as we're doing today, is the first step, and then working on coping strategies is the next.
And again, if anyone has any questions, you can ask those in the comments on Facebook. Right now we just have people saying hi, lots of people watching and listening. But if you have any questions on mental health, you can ask those. If you or someone you love needs help, you can reach out to Colorado Crisis Services, and I'll post the phone number for that. You can call or text. I'll post that in the comments as well. But as we continue on, Dr. Mark Hart, can you just talk about some of the short-term steps that can help healthcare workers as they're all going through this right now?
Yeah, there's a number of things people can do, and some of these are probably things people are already hearing a lot about. I mean, addressing all the practical things, making sure kids are taken care of, maintaining some kind of routine in your daily life that helps to counter all the uncertainty we're facing. Sleep is important. Everyone knows how important that is, but it can be really challenging to get good sleep in a time like this with stress and with worries on someone's mind. Having something like a daily wind down ritual where kind of trains your brain to get used to, this is what I do every night before I go to sleep. I turn off all the information, maybe light a candle, listen to music. Something where you have the same cues every night can really help the brain get ready to sleep and transition into sleep mode. Things like addressing all the anxiety around infection risk, making sure you get your information from some good reputable sources, potentially talking to your supervisor about concerns about infection. And then maybe some things towards calming your nervous system, stopping a few times a day, taking a few deep breaths can have pretty powerful effects. A lot of people think about starting meditation. This is a great time if it's on your list of things to try. And then something simple like maintaining a daily journal where you record a daily gratitude or 3 daily gratitudes. Not to minimize the extremely difficult times, but even when people are going through very, very difficult times, having the brain turn towards even very small things one is grateful for has been shown to help with stress and even things like depression.
Yeah, we've talked about some of these things, in all of our mental health segments, and it is probably maybe hard to think about doing some of them sometime or making the time to do some of these things, but it is important to kind of manage some of that stress. I'm just looking at, questions on Facebook, the questions I have from you guys. Dr. Nordstrom, can you just touch on how healthcare workers could manage their substance use and maybe other mental health concerns and any programs available for support for them?
Sure. Well, I think for healthcare workers, in frontline workers, very much in particular, there's stigma. We talk about stigma just in the general population, but stigma in terms of getting help is particularly high in frontline workers because there's a certain bravado, certain strength in not needing help. And this is a belief, this isn't a fact. And in fact, where I've been asked after traumatic events to be available to emergency workers, at times I'm seen as a pariah. Where people don't want to get too close because they're fearful that their coworkers might think that they need help. So that's a big part. It's hard to take that first step when you feel uncomfortable about how you might be seen. When it comes to substance use disorders, there's a huge danger of misuse. And one thing I ask patients is that beer or is that glass of wine anything to you other than a tasty beverage? Is it a way to fall asleep? Is it a way to wind down? And if it is, then it's frankly, you're using it as a drug. And it's important to be mindful of that because there's a lot of healthier ways to wind down. There's a lot of healthier ways to manage your sleep. And if you're questioning whether you have a problem, it's really important to get support. We have so many ways to get support these days. Most employers, have an EAP program, an employee assistant program, where you can get so many therapeutic sessions. there's the state crisis line that has both peer support as well as, and peer support is basically those with lived experience, as well as support from therapists. For physicians here in Colorado, we have the Colorado Physician Health Program, which has set up a separate process to allow physicians to get support from local peers. Really, in the end, though, it starts out with accepting the need for help, and that's really the hardest part for frontline workers.
Yeah, we talked a little bit about that. I just, thought, they're used to taking care of everyone else, so taking care of themselves probably takes a backseat a lot of the time. Dr. Thurstone, maybe you can add to that, and then also just talk about, Dr. Coley touched on this, but how these healthcare workers can prepare themselves for the long fight against the pandemic.
Yeah, I mean, there's so much good information here. I really appreciate it. And I appreciated what Dr. Coley mentioned about this perfect mental health storm, which we might be entering into. We have people with psychological distress to begin with. So about 23% of Coloradans right now are in a major depressive episode. Baseline, that's about 7%. So we're about triple normal right there. And then we know that liquor sales have increased, marijuana sales have increased, gun sales are about double what they were last year. And then we're getting ready to decrease funding for mental health. And so there's this potential for a perfect mental health storm here. And I'm glad we're paying attention to that. There is one thing that can be really protective to us, and that's the pulling together effect that we see after disasters. And that's where communities come together and they support each other. They donate to each other, they volunteer for each other, support each other. And I think that could be very protective. In terms of what to do about things, I like the acronym COVID, using COVID in a good way. So C stands for compassion, having compassion for ourselves and others. None of us is exactly ourselves right now. So I think that's important to be compassionate. O stands for being open to whatever thoughts and feelings are showing up, because as I mentioned, again, I mean, who is themselves right now? It's okay to not be okay, right? Especially right now. The V is values, so staying really connected to who and what is important. If there's one thing from the resiliency literature, it's staying connected to who and what's important to you. And then the I stands for inclusion, so including your friends and family. Camaraderie, we know, is extremely protective against burnout and psychological distress. And then the D stands for disinfect. So that's obvious in terms of disinfect, but also in the expanded, like non-literal sense of it, remembering the self-care that Dr. Marker talked about is really important. So that's that's the meaning of COVID for me.
I like it. Making COVID a positive acronym to help our mental health. I like it a lot. So Dr. Marker, I don't know if you want to add to that as well. And then also just, not only how healthcare workers can help themselves, but also how the rest of us can help them.
Yeah, I mean, I really like that COVID acronym so much better than the other COVID acronyms. But just I think pacing oneself. I think it's really important for. We talked a little bit about the moral injury, where someone feels like they can't do the right thing just because of the circumstances, or they can't help. But for healthcare workers to remind themselves of how much they are contributing is just so important. In terms of how the community can help, one thing I would say is remember, the full range of types of healthcare workers or frontline workers. We talk about hospital workers, EMT. We talk about grocery store workers. Some of the healthcare workers who are especially stressed are working in facilities like nursing homes, where they don't necessarily get the accolades, and they get a lot of the guilt around so many deaths in the nursing homes and how hard hit the nursing homes are. So just being supportive of the full range of healthcare workers, and everyone in the community continuing to do their part to take precautions to keep all the healthcare workers safe, and recognizing that they're supporting healthcare workers that way.
And Dr. Coley, maybe you can talk about too, we're kind of starting to reopen a little bit, things that when we talked about this before, how can we help our healthcare workers? It was stay home, don't leave your house. But now things are kind of reopening and more people are leaving their homes. So maybe your advice for continuing to help keep the curve flat and not overwhelm our hospitals and our healthcare workers.
Yeah, it's certainly true. We've shifted into a different mode, and I think this is going to be our maintenance mode for some time, because staying home forever is unfortunately not an option, even though it is very effective at flattening the curve. So doing it while leaving the house, I think is an important consideration. Many of the same things we've been talking about, wearing those masks, practicing the social distancing, making intelligent choices, washing your hands, those are continuing to be the most important things, because in the absence of actually physically separating the people, the best thing we can do is try to interact with each other when we leave the home in a safe environment. And by flattening that curve, we're significantly going to decompress our healthcare system and our healthcare workers. But I also want to echo a little bit about what Dr. Nordstrom said about the stigma about mental health disease in your healthcare worker. And I think one of the reasons for the stigma is not just the mentality or the attitude of healthcare workers, but it's potentially also the perception that patients or the community may judge healthcare workers who admit to having a mental health problem. And I think that's a fear of many of the healthcare workers, is that their patients may worry that they're not competent or they're not able to do their jobs properly if they admit that they're anxious or depressed or, unable to cope. And I think that that's one thing as the community we can do, is to remember that our healthcare workers are human and that they get diseases just like the rest of us. And this is just a disease or a condition that can be created by circumstances and genetic predispositions. So remember that compassion, the C from COVID that Dr. Thurston said, is remember that compassion to your healthcare workers. And if you are able to identify that one of your healthcare workers may be struggling, just like you would for a friend or any other community member, I think it is important to continue to raise those alarm bells, even for these people that we generally look up to as being the ones that would be our resource. But at this time, given the crisis of the situation, we can all band together and certainly be a resource as well for our healthcare community.
Yeah, and if you have friends or family members, really just pay attention to how they're doing, because they might need you to say, hey, I don't know that you're doing so well right now, kind of thing. And especially if they're a healthcare worker, like you said, they don't want to recognize something in themselves maybe. Dr. Thurston, someone asked, what was the meaning of COVID again? My phone died. So can you say it one more time, since it was so perfect?
Yeah, sure. The C stands for compassion for yourself and others. O stands for openness to feelings, thoughts that come up during this difficult time. V stands for values, staying connected to who and what matters to you. I is inclusion, so including your friends and family and keeping the camaraderie going. And D is disinfect. And I just want to say thank you to the Denver community, which has been so supportive to us healthcare workers. We got donations from the Mirage Foundation for toys for our children. We got donations from Kind Bars for employees. We got donations from We Don't Waste here in Denver of food, and it's very much appreciated. So thank you for the howling at 8 p.m. and thank you for the chalk on the sidewalk.
Yeah, and everything we've said, I think, is ringing true for people. And in the comments, they're just saying very true about stigma. It helps to talk to your coworkers and those around you, because we are all in this together. So yeah, connection, coping skills are key. People are just kind of commenting some of their tips as well. So thank you to everyone for watching and commenting with that. I do need to say before we go that we have partnered with Regis to provide some of our health education content. They have a counseling and family therapy program. They ask how we ought to live, and you can learn more about Regis University's counseling and family therapy program at regis.edu. So you can go check that out. Also, we have free mental health screenings at 9healthfair.org for depression and anxiety. They take 2 minutes to do. I do them every now and then just to kind of get my baseline of how I'm feeling that day, because it's 5 questions and it kind of tells you your level of anxiety or your level of depression that you're feeling that day. And there's resources to connect you to free help as well if you decide that you want to reach out to someone. Also, Colorado Crisis Services, I put that in the comments, the phone number to call or text. That is also a resource. But I'm going to let all these great experts go. Thank you so much, everyone, for joining us. And if there's any additional questions, you can post those in the comments and I will pass them along to get them answered. Thanks, everyone.
Thanks. Have a great day.
Thank you.
All right, we're done. Good job, everyone.
Yay.
Thank you so much. Hopefully you got what you needed. I think you got some good information. I know you all could have answered every